Hi, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes. And today we're going to talk about the necessity of follow up lab work. So, a lot of people complain to me that they have to do follow up lab work. And in my practice, it's non negotiable. You do have to do that. And the reason is that a number of the medications that we use, in particular the antibiotics, but also other drugs like LDN, ketotifen, um, and even methylene blue. They are excreted by the liver or the kidney, and if there are bacterial fragments or mycotoxins that are lodged in the kidney and are taking up space in the nephron and narrowing the lumen, okay, so that fluids can't get through, then you start to begin to see some kidney, what I call stress, and you'll start to begin to see a lowering of the GFR, glomerular filtration rate. And the glomerular filtration rate is super important because that's flow in your kidney. You have to maintain flow in your kidney. And that's why it's really important to drink 2 liters of water with electrolytes every day, whether you're on treatment or not. The body is made up of 80% water. Okay, so it's super important to keep yourself well hydrated so that you can maintain kidney health. I have several patients who were like landscapers. They were outside all the time, and they didn't drink appropriate water like they needed to, and they were on drugs like Ceftin or Bactrim, which are hard on the kidney, and they had very significant kidney function stress, and their GFR started to go down. And I had to take them off of the antibiotics because they didn't drink enough water through the day. And once we got them off of the antibiotics, they were fine. I mean, their kidney functions returned to normal because they didn't have that antibiotic stressor. But my point is this, is that there is a reason why we do these follow-up blood tests. It's not just for no reason. Believe me. We need to check your red blood cells, your white blood cells. I can't even tell you how many people have leukopenia. Leukopenia is when white blood cells drop. And when they drop below 3, you have to stop antibiotics and recalibrate the immune system and the white blood cells. It's dangerous. I mean, it's very dangerous. And so we measure we basically do a comprehensive metabolic and a CBC with differential so that we can just take a basic look at organ function and make sure that the basics are working. Just the basics. And we do that every 6 to 8 weeks, so it's not a lot. Now, I understand because there's problems with LabCorp and this and that and Quest. I understand. But the fact of the matter is that when you are on Polypharmacy, the way in which almost all of my patients are, you must take proper precautions and do blood work. And this is good medicine. This is the way that responsible doctors treat anything. If you're on chemotherapy, if you're on prednisone, if you're on hypertension drugs, if you're on anything, generally they do routine blood work to make sure that your body is handling it and that everything's okay. So I just wanted everybody to know that doing the blood work is not for naught. It's important. It's something that I require in my office, and I have for 27 years. And as a result of that, knock on wood, I have never hurt anybody, ever. 9,000 patients. I have never hurt anybody permanently with the medications that I use, because if there's a problem, I catch it quickly. So it's really important in my practice to drink plenty of water with electrolytes and get your blood work done. Okie doke, I hope you found this information helpful, and I hope you have a wonderful day. Take care.